Good afternoon, Mr. Nick. How are you today?
Good, how are you?
Good, thank you. My name is Katie Demers, and I will be your nursing student today.
Okay.
Do you mind if I pull up a chair?
Sure.
Okay. Now, if it's okay with you, I'd just like to ask you a few questions.
Okay.
Actually, I'm going to... I forgot. Okay.
Perfect, don't worry.
So like I said, I'm just going to ask you a few questions
Okay.
about yourself. Your name is...
Nick.
Nick, okay. And how old are you, Nick?
61.
61. Are you married?
No.
No, you're not married. Any kids?
No kids.
No. Have you ever been married?
A long time ago. 30 years ago.
Okay. How tall are you?
5'8".
5'8". And your weight?
185 pounds.
Okay. And do you work?
No, I'm retired.
Retired? What did you do?
I worked in a factory.
Okay. Okay, so what brings you in today, Mr. Nick?
I've had some chest pain lately and once in a while, and some acid reflux, and I'm just kind of worried. I had a friend of mine have a heart pass away last week, and just want to make sure I'm not at risk to getting another heart attack.
Okay. So you did say that you had some pain. So as far as the pain goes, I'm lost here. Would you say that it gets better or worse, or are there times when it's better or times when it's worse?
I think it gets a little bit worse when I'm climbing stairs.
Okay, and how could you explain the pain to me? Like, what do you feel?
It's just like a tightness, like some pressure on my chest.
Okay. And does it radiate? Do you notice that you feel it somewhere and you also feel it somewhere else, or the pain moves?
Well, it's kind of just like all like my chest and like a little bit of acid reflux, so it kind of goes up and down. That's about it.
Okay. Is it worse in the morning or at night or any time during the day?
Probably when I'm up like doing stuff is when it just is the worst. But when I'm sleeping at night, it's not too bad.
All right. If you had to guess, what would you say is the issue here?
I don't know. I just don't want to. I just feel like I might have another heart attack.
Okay, good. Relevant history. Do you have a history of hypertension, angina, high cholesterol?
I have high blood pressure.
And then there's the heart attack.
Yeah.
Okay, and in your past heart attack, any blood disorders, arthritis, hepatitis,
No.
any surgeries or hospitalization?
Well, just surgeries when I had my heart attack.
And hospitalizations from that too.
Right.
In your family history, any premature CAD, hypertension, elevated cholesterol levels? Heart attack?
I think my dad died of a heart attack, and my mom died of natural causes.
Okay. Any allergies to any meds, food, environmental?
No.
No. Do you take any medications?
Just something for high blood pressure.
Any other over-the-counter herbals?
No.
No. Okay. Do you smoke?
Yeah, 1 pack a day.
1 pack a day. Okay. And how long have you smoked for?
About 40 years.
All right. Do you use alcohol?
Once in a while.
Once in a while?
Yeah.
So, how many drinks
Just
a day or per week would you say?
maybe about 4 or 5 a week.
Okay. Are all your immunizations up to date?
As far as I know, yeah.
Do you have you gotten the flu shot?
Yep.
Yep. Oh, great. Do you use illicit drugs?
No.
Recreational?
Nope.
Okay. And when was your last physical?
About a year ago, I would say.
All right. And did you have a stress test?
No, I haven't.
You've never had a stress test?
No.
Okay. Do you exercise at all?
Not really, no.
No. It's recommended that you get 30 minutes of exercise per, 3 days a week, or 3 days a week, 30 minutes a day. And could you explain your diet to me? Do you take in a lot of salt or fatty food?
I would say I take in a lot of salt. I live by myself, so I eat a lot of TV dinners and a lot of takeout.
Okay. I ask everybody this question because of the prevalence of abuse in our community. I ask everybody, do you feel safe at home?
I do.
You do?
Yeah.
Okay. Do you have any questions for me at this moment?
No.
No? Okay, if you don't mind, I'm going to go ahead and take your... we're just going to discuss Mr. Nick's vitals. Now, we've already taken them, but a few things I'll mention is that before you take vitals, you would ask the patient if they had had anything to eat or drink in the last hour, if they had smoked or exercised in the last hour. You would want them to have their both feet flat on the floor, and the arm elevated on a pillow or something like that. So as far as his vitals go, Mr. Nick, I'm sorry, your blood pressure was what we would consider pre-hypertensive. It's still within range, but on the high side of range. Your systolic blood pressure was 135, which is within range but high. And your diastolic was 92, which is actually over what we recommend to be within an appropriate range. The pulse, your pulse was 98. I took your pulse radially, and it is on the high end of normal, but still within normal range. I would say it was a 2+ and regular.
And what is normal range?
Sorry, normal range is anywhere from 60 to 100 beats per minute. Respirations was 18, which is, for your age, normal range is between 12 and 24. So 18 is within your normal range. Your temperature was slightly
High.
high. Was slightly high, but nothing really to worry about. Could have been the hike up the stairs, anything that could.
And what's the normal reference range for temperature?
Normal reference range for temperature would be anywhere from 36.5 to 37.5. So you're okay, but high end of normal.
What's his temperature?
What's my temperature?
37. The objective data, I'm going to do a general survey on the patient. The patient seems relaxed, alert and orientated. He's dressed appropriately for the weather and his age. He answers my questions appropriately. His development seems appropriate for his age and gender. And he seems to have a full range of motion in his upper limbs, as well as when he walked in, I noticed that his gait and everything was appropriate also. We're now going to assess the precordium, and I'll start by inspecting the anterior chest. Mr. Nick, do you mind if I pull your gown down?
Go ahead.
Okay. So here I am looking for any, I don't see any lesions, any masses, no heaves. The chest seems to rise and fall symmetrically. So now I will, I would just look at it.
You look at it and locate it with your finger.
Okay. I'm going to inspect the point of maximal impulse, which is here. And
You may see it in a normal person, you may not, depending. Yeah, so fifth intercostal space.
Fifth intercostal space.
It'll be, again, just count down here and about right here, follow it under. About the nipple is usually about the fifth intercostal space.
Okay.
Feel right where my fingers are and push a little hard. Feel that pulse?
Mm-hmm.
That's just like your radial pulse. You're assessing for, do you feel it more than just that spot? Okay, if it's big and enlarged, or if it's more laterally displaced, that means something to us as nurses. So you're feeling, does it feel regular?
it does feel regular.
Good. And is it nice and springy?
Yep.
Good.
Nice and springy.
Good. And now, so use the whole palm of your hand.
Okay, then
And now you're feeling for any heaves. It's okay. He doesn't mind. And your patients won't. They're going to follow your lead. Just let them know I need to place my hand on your chest. And what I'm feeling for is any heaves in your chest.
I'm just feeling for heaves, and I don't notice any heaves. So,
And then aortic, yep, pulmonic.
yeah. So I'm just palpating the aortic.
And just hold still right there. Yep. And then so what you're doing is feel for the heart to beat a little bit. Do you feel a heave? And then go to the next side, pulmonic. And then down to the third intercostal space, the fourth intercostal space. And allow the heart to beat a few times. So if there was a heave, you'd pick it up. Because heaves are important for us to know.
Then over midclavicular. There you go.
Yep. Good job. And then repeat the same process with your finger pads.
Sorry, I should have asked. Let me know if you feel any tenderness or
Okay.
any pain. Any pain at all?
No.
Tenderness? Any pain or tenderness here?
You're doing great. And just move over more lateral. Perfect. And no tenderness whatsoever?
No.
Good. So IPP,
A.
right on. That's okay. We're all the student nurse, so it's all good.
So now I'm just going to auscultate same areas.
And with which side of the with which side of the stethoscope
I'm
first?
going to use both, but I'll do the diaphragm first.
Wonderful. And so always start with your PMI, your point of maximum impulse, or your apical impulse. And what sound are you going to hear best at the apical impulse or the apex of your heart?
This one.
Exactly. Nice
Perfect.
job. Go ahead and put it there and listen for a few beats.
So would I have him hold his breath?
No, you can just, unless it's interfering. If it's
Okay.
interfering with you hearing, but chances are it's not going to. You might even be able to hear it through that shirt. Press nice and firm and listen for S1, S2. How are you going to figure out which one's S1?
Checking the radial pulse.
Yep, so with your left hand, can you grab his radial pulse? And now re-listen. Go ahead. And re-listen there again. When you feel the pulse, that's your S1. And what valves are closed when you're making S1? Exactly, thank you. Excellent. Yeah, your ventricles are squeezing, so good.
I don't need to.
Nope.
So the aortic.
And while she's doing that, what are the landmarks for the aortic pulse? Or sorry, the aortic valve?
The pulmonic.
Second intercostal space.
Wonderful. Yep. To the right or left of the,
Right.
to the right, excellent. Herb's
Herb's
point,
point.
yep.
Tricuspid.
Good, you guys are doing great.
Oh, I hear it loud there. Mitral.
And wonderful. And what are we listening for over each valve? What are we really trying to pick up?
That's it.
Yep, or the bell now.
And I'll do the same thing but with the bell. So
And if his breathing's interfering, you can go ahead and instruct
it doesn't
him.
seem to be.
But go ahead and instruct him for the sake of the OSCE.
Okay, so how like
Take a deep breath, exhale completely,
and hold it.
and hold
So I
it.
ask him to hold it the whole time.
No, each valve.
You're
Oh,
gonna,
okay.
yeah.
Let him breathe in between.
I could hold it.
Yeah?
Okay. So
He's a
just
swimmer, he could. No, I'm just
Take
kidding.
in a deep breath, breathe all the way out, and hold it for me.
And are we at second intercostal space? You find the clavicle? And then find one, find two. Yeah, you're right there, sorry. Listen
Okay,
for
breathe.
some beats. Let me know.
Deep breathe in, deep breath in, deep breath out. And hold it.
Excellent.
Okay, breathe out. And deep breath in. Okay. Again. Okay. Mitral. Oh, I didn't start at the PMI. Am I yelling? Okay.
Wonderful. And any health teaching
Can
you
you
want to
start
give them?
at the PMI? Sorry.
Yes. Go ahead.
For when you're listening for the bell, for the PMI, actually it's last because you're going to have them roll over to the left
Oh,
side.
right, okay.
So
Which I have to
it's
do.
going to be first when you're using your diaphragm, but when you're going to the bell to hear adventitious sounds, you're going to have them turn to the left side, listen as your bell
Okay.
for your PMI.
So, Mr. Nick, I'll just have you roll over slightly to the left if it's comfortable.
And here's where it gets tricky. Because in order for you to pick up S1, you also have to palpate his pulse. So, yep, you're doing great. So the dexterity, perfect. Can you reach over?
Maybe slide over there.
You're doing great. And count for a full 60 seconds.
Oh, just for that one?
Yes.
Just for-
Okay.
And what you're listening for during that 60-second is the rate and the rhythm. Count it in 60 seconds, so you may need to be looking at a watch. Okay, you can lay it on the bed. And you're also counting, or you're also assessing the regular versus irregular. Is it love dub, love dub, love dub, love dub, or is it love dub, dum, love dub, dum, love dub? Is it abnormal or irregular or something? Okay, are you hearing any murmurs? All right. And did you want to wrap up with any kind of health teaching for Mr. Nick? And anyone can chime in here now. It doesn't have to be Katie. Okay,
Yeah.
yeah, let's let her off the hook a little bit. So what health teaching would we want to do with Mr. Nick, or how would we want to wrap up this OSCE?
I think I would say because he's already suffering from hypertension or experiencing hypertension, that he should have a salt-free or low-salt diet.
Wonderful.
Exercise.
Yeah. Exercise is key, because he didn't really say he was exercising.
Right.
Yep.
A lot of frozen meals.
And were you a smoker?
Pack a day.
So,
Right.
Me and Nick are just going to take a time out here and we're going to debrief, talk about some of the stuff that we forgot or that we could add on. A few things I forgot. I should have cleaned my stethoscope with an alcohol swab, so I'll just show you now.
And while she's doing that, what other things did you notice, Nick?
Let's see. Oh yeah, during the PQRS TU the pain scale, she could have asked about the 1 to 10 scale.
So when she did an awesome job of
Yeah, she
PQRST
did.
for pain, but we missed the scale piece.
Just the scale, yeah.
And some of your
10.
patients aren't going to know what 10 means and 0, so please explain that. Yeah? Alcohol?
So yeah, the types of alcohol, she could have asked what types of alcohol that the patient was drinking. Also, maybe elaborated more on the, asked me more of an open-ended question about my diet. So what like kind of, not just do you have high salt intake, more like what do you eat like on a daily basis?
And Shannon, you made a comment. We won't put the camera on you, but what was your comment?
Just that she did PQRST on the chest pain, but she could have also done it on the acid indigestion.
Awesome. Yeah, because what types of patients might have acid indigestion, or what might that acid indigestion be?
Acid indigestion could be signs of heart attack.
Yeah, it could be.
Females.
Exactly.
Females
Yeah,
or
for those
diabetics.
diabetics and females, they have that that atypical chest discomfort. Good. All right, you guys are doing awesome.
And then just the lastly, your term, using CAD.
Oh, yeah,
Oh.
I used CAD, I used the abbreviation. He might not know, the patient might not know what CAD is, so just, it's better to,
Ask coronary artery disease.
yes, use the full name.
Perfect.
Perfect.
Okay.